Good morning. My name is Abhinav Arulanathan, and these are my colleagues.
My name is Ruhi Galati.
My name is Kunal Dewan.
My name is Faraz Khatak.
And my name is Isma Kasavoy.
Together, we are Reaches, and we hope that by presenting to you today amidst this worldwide pandemic, our voices and our ideas will help, like our acronym states, rebuild environments affected by COVID-19's heart effects and severity. Now, as an ambassador to a heart health-focused organization, I'd like to start this presentation by talking to you about a topic that's simple, yet commonly misunderstood. What is heart health? It's very crucial that we talk about this topic because while COVID-19 takes the spotlight as the pandemic of the world, with over 550,000 deaths this year, another pandemic plagues the world every single year, with 550,000 plus deaths within our nation alone, sudden cardiac death. Now, good heart health is typically defined by healthy structural and electrical function of the heart, while poor heart health is defined by the opposite, correct? Well, yes, but we're discounting the fact that health does not only encompass the end goal, but also the steps it takes to maintain and achieve this goal. This has a lot to do with preventative health. My colleagues Isma and Faraz will touch on that later. With that being said, let's bring our focus back to the heart. It's an incredibly crucial and powerful organ, but it's also a deadly and dangerous one. One small problem with the heart can have a fatal implication. There are so many conditions that can lead to a heart problem, and a heart problem can lead to so many other conditions, which is why knowing your body, your heart, and the conditions it may face, which in this case would be knowing your risk for COVID-19, are the proper steps to take towards good heart health. To further elaborate on my discussion of the heart and why exactly it relates to COVID, I'll pass the floor to my colleague Ruhi.
Thank you, Abby. Although COVID-19 has impacted the lives of people across the globe, not everyone truly understands exactly what this virus is. COVID-19 is a single-stranded RNA virus, meaning it uses RNA-dependent RNA polymerase enzymes for replication and is caused by SARS-CoV-2, a second strand of the SARS-CoV virus. Furthermore, the greatest amount of coronavirus diversity is seen in bats, leading to the theory that bats are the origin for the spread of COVID-19. Even though the exact cause for the pandemic is still unknown, it is important that people understand COVID and its effects. While the mortality rate is low at 0.7%, people with heart-related complications are at a great risk for COVID-19. For example, patients with cardiovascular diseases and heart-related COVID symptoms, such as fatigue and palpitations, have a death rate of 10.5%. One leading theory behind COVID and its relationship to the heart involves the immune system. When reacting to the virus, the immune system can become overwhelmed, resulting in a cytokine storm in which the immune system releases cytokines, or immune messengers, into the bloodstream when it is not needed. As a result, systemic inflammation occurs and causes blood clots or even a stroke. Additionally, inflammation causes several cardiac issues related to COVID-19, such as heart failure, acute respiratory distress syndrome, arrhythmias, cardiovascular shock, and myocarditis. As a result, it is crucial that people understand COVID and educate themselves on COVID and its impact on the heart. Thank you. I will now allow my colleague Kunal to talk more about the targeted communities.
Hello, my name is Kunal, and I will speak to you about specific targeted communities in relation to COVID-19 transmission. Now, when talking about COVID-19 stats and figures, it is important to recognize that there are two main categories that best emphasize which communities and individuals are at higher risk than others, these being the categories of ethnicity and age. Now, as for ethnicity, the most pervasive disparities are prevalent in the communities of African American and Hispanic descent. SCARF conducted its own evaluation and study over the summer, where we oversaw 420 patients with COVID-19 as of July 5th, 2020. 85% of these individuals were either Black or Hispanic, and only 2 deaths had occurred out of the entire population, both of which being Hispanic females. Now, as for age, the CDC found that approximately 80%, or 4 out of 5 deaths that had occurred in the United States, were in adults that were over the age of 65. Now, to talk more about the reasons for why these disparities exist, allow me to introduce my colleague Faraz.
Thank you, Kunal. Now, apart from genetic predispositions, the reasons for these disparities can be traced back to past historic discriminatory policies such as redlining. Redlining has led to substantially lower homeownership rates, especially for African American families. The national homeownership rate for African American families is 44%, while Caucasian families is 77.7%. Another reason for these disparities are language barriers. It is extremely important that people can easily communicate with each other, especially during these times. Not only this, but in a study it was found that among individuals stating a need for mental health services, non-English speaking Latinos were substantially lower than Caucasians or even English speaking Latinos who have received these services. Access to technology could play another factor because in areas with less access, they can't better receive telehealth or educate themselves in areas that do have more access. So essentially, education is key, which kind of leads me to my next topic of preventive medicine. Preventive medicine will continue to be overlooked if people aren't educated. Preventive medicine means incorporating public health measures at a community level, such as promoting healthy behavior or screening for diseases. It means preventing the problem before it even happens. So, having bad cardiac health leaves people at more risk for COVID. So some of the ways you can make sure you don't get bad cardiac health or maintain good cardiac health is keep up with your supplements such as coenzyme Q10 or omega-3. Make sure you keep your mind healthy. That means when you look at the news, don't blow things out of proportion and don't get too stressed out. Then of course, make sure you don't have a high blood pressure, high cholesterol, maintain a healthy diet, exercise, don't smoke, things like that. Making sure you do these things and educate yourself is extremely important during these times because of COVID. Now I'll pass it on to my colleague Isma to talk furthermore about COVID and our Scarf Care package.
Thank you, Faraz. The COVID-19 pandemic has a tremendous effect on all of our lives, but it is important to stay educated on symptoms and other concerns. Common symptoms of COVID-19 range from coughs, fevers, chills, fatigue, shortness of breath, loss of taste or smell, or even problems with the gastrointestinal tract. Unfortunately, most people dismiss these symptoms as mild and ignore them. This can have negative repercussions, as people may unwillingly spread the virus while not even knowing that they have it. That's why it's important that we educate our community members on reaching out to healthcare physicians when recognizing any symptoms or concerns. Adapting to telehealth is a huge part of preventative medicine, as it is a way to communicate with your healthcare provider without leaving your house. It is extremely beneficial during these times, as people can get care without having the fear of being infected with COVID-19. Not only is telehealth more affordable, it is also more efficient. 91% of telehealth care patients have had greater or equal experiences compared to direct care. Elite Cardiology has done a great job shifting to this new approach, and if applied to other offices, can be a great way for patients to continuously get care. So, why is prevention so important? Not only can COVID testing be unreliable, as you can test positive one time or negative the next, treating COVID can be very expensive. Treating costs can range up to $500,000 per person. COVID has also completely turned our lives around. Not only has it prevented us from living normal lives, it has other detrimental consequences, such as shutting down our economy. So other preventative approaches include social distancing, wearing masks, gloves, regularly disinfecting frequently touched surfaces, and avoiding mass crowds and travel. Unfortunately, not all communities are able to access all the necessities they need in order to stay safe. And that's why we created the Scarf Care Package, which stands for COVID, Aid, Resources, and Equipment Package, which will contain masks, gloves, hand sanitizers, wipes, and the Scarf Coast Bar to provide significant resources to underserved communities. We hope by distributing this package to targeted communities, we will be able to keep them safe, educate them on the proper steps they need in order to deal with the pandemic, and ultimately improve their heart health. Now my colleague Ruhi will talk more about the Scarf Care Package.
Thank you, Isma. The Scarf Care Package is designed specifically to fulfill the needs of people from these low-income and minority communities. On the inside of the box, there will be an infographic focusing on 4 main topics: COVID-19, heart health prevention, and resources. Some of our packages will also contain an infographic translated in Spanish for Spanish speakers. By providing targeted communities with our Scarf Care Package, people will now have the chance to educate themselves and practice prevention. We believe that with the Scarf Care Package, we will be able to make a difference in numerous lives. I will now allow my colleague Abby to talk more about the Coast Bar mix.
Thank you, Isma and Ruhi. Now, in our discussion of the care package, Isma mentioned a product called Coast. This is something we've been working on for a very long time, and it has, as such, gone through many changes. It started out as a simple drink mix, like we have detailed on our poster, that you can mix in your juices and your smoothies. But we wanted to take its efficacy, its availability, and its compliance rate one step further. What we've arrived at is the Scarf Coast Bar. The bar contains omega-3s through the form of algae. COAST is an acronym that stands for chlorella-based omega-3 anti-inflammatory snack treatment, and it's a simple, dietarily friendly way to get your omega-3s through an abundant, renewable source. And while algae is our main ingredient, every other ingredient in the bar has its own plethora of heart benefits. Getting your omega-3s, especially during a time like this, is extremely important, as Faraz mentioned, because omega-3s are vasodilators as well as endothelial cell healers, which essentially means that they allow for better blood flow and prevent clots, swelling, and the other cardiac implications of COVID-19. By including this bar in our care package and making it available to the general public, we truly bring together everything that we've talked about in our presentation today. Heart health, the pandemic, disparity communities, and finally and most importantly, the impact of preventative health during a time like this. There's really only one way for us to get through this pandemic, and that is together. We hope that by talking to you today, we've already started to make our impact. We must work to educate communities, to eliminate disparities, and to achieve new reaches against the pandemic. Thank you all so much for your time.